What's up, everybody? Got a Narcan kit here for us. I'm going to be placing it on 51. Just a quick training tutorial on how we're going to use this. So in our Naloxone kit or Narcan kit, this is going to be for opioid overdoses or suspected opioid overdoses like fentanyl, morphine, Dilaudid, things like that. So inside our kit here, you can zoom in a little bit, Kyle. We have 2 doses of Narcan in glass ampules. We have a nasal atomizer, which pushes it into a mist. We have a syringe, and we have a needle to draw up our solution with. On the other side here, there's just some spares of all I just went through, and a couple of directions on what to suspect in an opioid overdose. You can take a peek at that at your earliest convenience. So how we're gonna draw this Narcan solution up, first thing we're gonna do is we're gonna open this capsule here with our 2 doses. So we'll bring out one, and you can see here on the side, we want to check for an expiration date and make sure it is actually Naloxone. So this is for December 2024, which currently is not expired. On the top here is a plastic protective piece so we can safely break this ampule without having to worry about getting glass in our fingertips. So this is already right over top of it, and it's a nice safety measure to prevent us from getting injured. So we're going to prepare our equipment, first step. So we're going to take our syringe out of our package. We're going to take our draw up needle out of our package, and it just screws on. Very simply, just screw it hand tight. Next, we're going to give this to our partner or place it on a flat, clean surface. We're going to grab our Narcan ampule. We're going to grab the protective piece at the top, and you're just going to snap it backwards. It's very easy, very safe. The whole top neck of this will come off. I have another one here just to show you what the neck looks like. So that will come right off, and you'll be able to draw up the solution right in here. So I'm going to show you on the one that doesn't have a protective ampule cover, because these are on there very good and I don't want to break this. So for the purpose of this demonstration, I'll break this one myself. You're going to take your syringe with the draw up needle, expose it, place it into the bottom corner of the solution, and you're going to draw the plunger upwards. If you have air, don't worry about it. You want to make for sure that you have all of the solution. It's going to be 1 milliliter. We're going to take our sharp, we're going to put it down so we can dispose of it safely later. Place the cap back over the needle. If you are in an unsteady environment, an uneven surface, it may be wise to put it on a table and recap it like such. Next, we're going to take our draw up needle off. It just screws back off. In the plastic piece here, there's a nasal atomizer, it's called. So this is going to turn our fluid into a nice mist. This is what's going to go in the patient's nostril. So we're going to open this up. Again, just like the draw up needle, we're going to screw it on. We're going to give this a flick or 2 to get any air bubbles out and push the fluid up towards the beginning of the plunger where it reads 1 milliliter of solution. Now this is ready for administration. So what we're going to do is we're going to place this into the patient's nostril. We're going to aim inwards and upwards. So it's going to look like this, in and up. And what this is going to do, when we press it really hard, it's going to turn it into a fine mist. So Kyle, if you don't mind zooming in a little bit, we'll get a picture of this. So this is what's going to go in the patient's nostril. Okay, we've emptied our dose. Now we're going to wait to see what effects this brings. If need be, we can repeat this dose. Thank you very much. If you have any questions, give me a shout. More than happy to go over this with you. Take a second, take a peek at it. It will be placed in the medical kit on 51. Special thanks to Kyle for being a cameraman.